Bedside Shift Report Capstone Project by Blankenship. Miscommunication among healthcare providers during shift change and when patients are transferred to another area of the healthcare facility accounts for the majority of major medical errors. Bedside Report was included as part of the Joint Commission's patient safety goals and is a requirement at most facilities. Bedside reporting is defined as the transfer of information as well as the transfer of responsibility and authority in care across the continuum to include staff opportunities to ask questions, seek clarity, and confirm. Bedside Shift Report focuses on communication between the two nurses as caregivers. Conducting a bedside report as opposed to just a nurse-to-nurse report has the added benefit of patient and family input as well as accountability of orders and patient care by the oncoming nurse and the outgoing nurse. One of the most essential components of healthcare is to provide quality, patient-centered care. One of the easiest ways to involve the patient and their family in the care is for nurses to participate in bedside report. Including the patient and their family members in bedside report can decrease patient anxiety, increase patient safety, and potentially increase the patient's compliance with their own plan of care. Staff that participate in bedside report are also driven to take ownership and accountability of the care of the patient. Bedside report is relatively simple in practice as it does not involve many stakeholders. The primary stakeholders involved in this practice are the oncoming nurse, the outgoing nurse, the patient, and any family members that happen to be present. Additionally, the provider is sometimes involved, but this is not necessary. By involving the patient and family in the plan of care, mistakes can be reduced, and it provides a real-time conversation about the plan of care and what the patient can expect during their stay. Bedside report can also save time for the oncoming nurse by allowing time for questions, as she or he has another nurse present to review any wounds, drips, or equipment being used for the patient. Additionally, the patient has the opportunity to witness a transfer of care and a transfer of trust from nurse to nurse, as it gives opportunity for the outgoing nurse to introduce and manage up the oncoming nurse. If implemented properly, bedside report can result in improved patient and nursing satisfaction and patient safety outcomes. Additionally, bedside report could potentially impact patient care economically as it can reduce medication errors and practice errors since there are two nurses at the bedside reviewing the plan of care. Patient falls and other safety incidents could be reduced by this practice as well. This practice would strengthen communication between the healthcare team and patients and families. It could also improve patient outcomes as patients would be more satisfied with their care if they feel more confident in the healthcare team. A SWOT analysis conducted on bedside report indicated there are many strengths related to the implementation of this practice. Change of shift report is an imperative part of the exchange of information between the oncoming and outgoing nurse. At the time of report, critical information is conveyed and the plan of care must be properly communicated between the two nurses to ensure patient safety and compliance with the plan of care. Most staff would be receptive to this process as they are generally willing to adopt new practices that will improve patient care. Additionally, there is great commitment from the nurses to provide quality patient care. In fact, nurses take pride in the care that they provide to their patients. Lastly, staff work well together and hold each other accountable for putting new practices in place. In addition to the strengths, there are also many weaknesses associated with the implementation of this process. One of the biggest problems found is that staff might not be sure what to include in the report, therefore they might think that it takes too long to complete. This might make them resistant to comply with the new process. Another issue related to perception of time is that nurses frequently give report to multiple nurses, which can be time-consuming and frustrating. Additionally, the fast-paced environment of the emergency department could lead to multiple interruptions, causing nurses to just stop giving report altogether to respond to the current interruption. Lastly, due to multiple interruptions during the shift, the outgoing nurse may be trying to tie up loose ends during the report, such as assessments, charting, etc., and is not giving her full attention to the oncoming nurse. Leaders of the department have an opportunity to promote and implement this process into daily practice. Leaders would need to include staff in the planning, process development, and eventual implementation. Department leaders would also need to frequently monitor compliance as well as input from staff related to process improvement. One way to ensure that staff are participating in the process is to include education with implementation. Statistics and information related to patient safety, Joint Commission requirements, and patient satisfaction surveys should be provided to staff when the process is rolled out. Staff will be more likely to comply if they are aware of why the process is being implemented. Additionally, getting shared governance or unit councils involved in auditing, revising, and implementing the process is a good way to develop and implement this new initiative. There are many threats that could derail the execution of bedside report. Emergency department nurses are very busy and their days are variable. Things can change in a moment's notice, therefore providing many interruptions. New patients are arriving, there are medical emergencies, call lights, and many other changes in status that can pull patients away from the bedside while giving report. Additionally, sometimes patients are sleeping and do not want to be bothered, and sometimes family members are in the room, posing a potential patient confidentiality issue. Another threat related to the implementation is insufficient unit resources for staff education and training sessions. Implementing the bedside report could also be an issue because some nurses may be hesitant to participate because they are resistant to change. Sometimes seasoned nurses are resistant to change because they believe the current process is sufficient. They are resistant to change because what they are currently doing works and has always worked. There are many theories and studies that support the practice of bedside report. Some studies show that bedside shift report is an integral part of providing safe, effective patient care. In an article written by Helen Ballantyne, a staff nurse from England, stated proper shift report can ensure patient safety, continuity of care, and can improve the overall patient satisfaction scores. It is important that nurses are aware and address barriers that prevent adequate shift report at the bedside. Ballantyne's study focused on the process of implementing effective bedside reporting process. It also reviewed various types of processes as well as the importance of communication between nurses and barriers they might face when trying to conduct this report. The study also discussed how patients are affected and factors that must be considered with conducting report, such as patient confidentiality, interruptions, and whether the patient wants to be involved, also information that should be exchanged. Additionally, the study stated that when conducting bedside report and involving the patient, it is important to find out if the patient wants to be woken for the handover and whether they want their relatives to be involved. The study reported that if nurses are not adequately trained in conducting the bedside report, patient safety could be compromised. It is also important that a thorough training plan is developed and rolled out to staff to ensure desired outcomes. Carrie Sand Jecklin and Jay Sherman, both registered nurses, conducted a study with a goal to quantify outcomes of implementing bedside report into practice on the unit. Their research identified multiple benefits of implementing bedside shift report, including reduction of patient falls, medication errors, and nurse and patient satisfaction. The outcome of the research showed that there were significant impacts in multiple areas after the practice was implemented. The study also showed that the multiple positive outcomes were in fact related to consistent bedside report. It also showed that if properly implemented and consistently performed, bedside report can improve patient and nurse satisfaction and patient safety outcomes. While proving that this is a necessary process that should be implemented in healthcare facilities nationwide, it was shown that leadership must be involved in the implementation process and must consistently monitor the process to ensure compliance. Celeste Scovell's study about bedside shift report discussed the importance of developing a process to teach bedside report. Bedside report is not something that nurses learn in schools, so it is important that leadership develop a training program for the staff. The article focused on the structure of bedside report and outlined what should be included in the process, as well as problems that could present during handoff. The article discussed how important nurse-to-nurse report is and how it impacts patient care and patient safety. It discussed other types of handoffs such as face-to-face, written and taped, and outlined the pros and cons of each. Ultimately, the article concluded that bedside report is perhaps the most effective process and it produces the best patient outcomes. There is much research to support the fact that effective leadership is essential to implement change in any professional situation, especially in the nursing profession. There are many styles of leadership that are utilized when managing a team, such as the transformational leadership style. Transformational leadership is the theory of leadership where the leader works closely with the team to identify a change that is needed. The leader then works side by side with key team players of their team to guide and implement the changes. Transformational leadership could be used to implement nearly any type of change in the healthcare setting. This style encourages improvement and excellence, all while allowing the leader to exhibit integrity and a team-centered approach. Being a successful and effective leader requires more than just telling the team what to do. In order to apply necessary change, the leader must possess communication skills as well as the knowledge required to implement the desired results. Bedside shift report is a method of nurse-to-nurse report that is practiced in many healthcare facilities across the nation. In order to implement this practice, the leaders would need to roll it out to their staff, and in order to implement it into a daily routine, they would have to get the staff to buy into the idea that the new process would improve their patient care. They would also need to be well informed about the process and be able to clearly communicate the expectations. They would need to identify key players to help initiate the implementation of the new plan, and then must be available to their team to answer questions, offer support, and encouragement. In order to implement bedside shift report in a nursing facility, the transformational leadership style would be a great opportunity. The leader should make sure they are fully aware of the process and how it should go, and then identify some role models, and then frequently review the process for improvement and adherence to the policy. Leaders would need to remind staff daily that it was an expectation and lead by example when performing this practice anytime they participated in patient care. Managers that model the transformational leadership style motivate their staff to work toward a common goal rather than having them do something just because the leader told them to. An ethical leadership style is a leadership style that is guided by ethics, values, and dignity of others. An ethical leader is motivated by morals and the well-being of others. Both styles have been proven effective, and both are ultimately centered around morality and ethics. However, it seems as though transformational leadership style is rooted in teamwork and integrity, while ethical leadership is focused on ethics and the dignity of others. Many leaders exhibit characteristics of both and implement a hybrid style of leadership that implements the ideas of both theories. Leaders of this type are ethical, morally responsible, and motivate their associates by utilizing a team-centered approach. Leadership can be defined in many ways because it has many components. In order to implement change, a leader must possess a clear vision of the desired process and must be able to communicate it well to their staff. To successfully implement the desired change, the leaders must go to their staff, have them buy in, and work alongside them during the change. They need to provide all the information and tools necessary to implement the change. A leader should hold their staff accountable for sticking to the process and implement it correctly as part of the routine. To implement bedside shift report, a hybrid of Lewin's and Rogers' theories would likely be used. Because it is necessary to streamline processes and ultimately improve patient safety, it will be necessary to freeze, change, and refreeze the current process. But you would also need to get staff to buy in, which is Rogers' theory. Bedside shift report would allow for improved teamwork, accountability, and open dialogue between nurses and patients. Implementing a new process will improve outcomes for patients and staff. The plan would be to utilize a hybrid model for the process. Lewin's theory would be implemented by freezing the current processes, developing new processes, and refreezing and implementing the new process. Rogers' theory would come into play because as champions, we will need to identify to implement the process and get others to buy in. There are many ways to implement changes in the healthcare setting, but the ultimate goal is to provide quality, safe patient care. Implementing change in any professional situation could cause problems among staff and leaders. Many times, staff are reluctant to change and don't always buy into the new plan. However, change could have a positive effect on staff as well. While working to implement new processes and policies, staff could learn about themselves in their own practice and see firsthand how implementing a new process could have a new positive impact on their patients. Implementing this process could empower staff or even force them to collaborate with the rest of the multidisciplinary team, ultimately improving patient outcomes because they would all be on the same page. Seasoned nurses could share experiences of past change and could be useful to staff that are not familiar to change. In order to evaluate the changes, leaders should have a plan to evaluate the implementation of this new policy. Leaders would need to include staff in the planning, process development, and eventual implementation. Department leaders would also need to frequently monitor compliance as well as input from staff related to process improvement. Frequent evaluation, audits, and discussion with staff regarding the new plan would be necessary. Leaders should be present to support the staff while the plan is being implemented and hold staff accountable for adhering to the new policy. Leaders should conduct periodic audits to identify staff that are non-compliant and then follow up with those staff. Leaders should provide positive reinforcement when they see staff conducting the new policy, and eventually the new policy will become a standard. One of the easiest ways to involve the patient and their family in the plan of care is for nurses to participate in bedside handoff. Including the patient and family members in bedside report can decrease patient anxiety, increase patient safety, and potentially increase the patient's compliance with their own plan of care. Staff that participate in bedside report are also driven to take ownership and accountability of the care of the patient. The objective of this practice is to improve nurse communication during bedside handoff, as well as to promote increased safety. If implemented properly, bedside report can result in improved patient and nursing satisfaction and overall patient safety outcomes. Additionally, bedside report could potentially impact patient care economically, as it could reduce medication errors, practice errors, since there are two nurses at the bedside reviewing the plan of care. Patient falls and other safety incidents could also be reduced by this practice. Bedside report could strengthen communication between the multidisciplinary healthcare team and the patients and families. It could improve patient outcomes, as patients could be more satisfied with their care if they feel more confident in the healthcare team. Ensuring that all nursing staff are compliant with the new bedside reporting process will allow patients and family members to be active participants in their care. It will allow the oncoming nurse to lay eyes on the patient and ask any questions of the outgoing nurse. By participating, it can improve communication by eliminating any gaps in information, seeking patients' input on their plan of care, and promoting patient safety.